Again, I'd like to welcome everyone to the 3rd International Conference on Stigma at Howard University here in Washington, D.C. We're also on the web at whoyoucantell.org. I want to go over some quick housekeeping rules before we get started in our important dialogue this morning. First, everyone should have a program book. Let's see where my program book is. And online, you can also download the program book online at whoyoucantell.org. Inside your program book is the agenda as well as biographies on all the speakers and panelists today. If you do not have one, you can get one at the registration desk right outside the door here. whocanyoutell.org. Also, you can follow us on Twitter at the same name, Who You Can Tell. Let's see, please don't forget to fill out your evaluation forms. There's a white form that's for demographic purposes. Please fill that out. Please turn off your cell phones or put them on vibrate. We also have coffee and tea downstairs. We're asking for a small donation if you decide to take a cup. And there's also an eatery in the basement that serves food and drinks. Bathrooms are located outside the door, inside kind of women on one side, men on the other. Also, we're offering continuing medical education credits. If you have, also that information is inside your program booklet. If you are here for CME credits, make sure that you've registered outside at the CME registration desk. Again, thank you for coming, and we're at whoyoucantell.org. I know I've said that a lot, but we're streaming live. I will be with you all day to help guide us through and define what stigma is, its impact on our community, and what we can do to combat it. To help me this morning, we have a special guest. We have Cynne Simpson, an Emmy Award-winning Edward R. Murrow Award anchor from ABC7 WJLA here in Washington, D.C. She has covered international news and entertainment stories, has done exclusive interviews with Oprah Winfrey, First Lady Michelle Obama, Maya Angelou, and countless others. Prior to joining the team at WJLA, Cynne was an evening anchor at WGCL in Atlanta, Georgia, and most importantly, she started building her foundation for excellence, graduating magna cum laude from our very own Howard University. Yay! Please welcome Howard University 2011 honoree for giving back to her community and ABC anchor, Cynne Simpson.
Well, good morning, everyone. Thank you so much for coming and being a part of this morning's discussion. I also want to thank the people who are joining us via live stream today. We've got people from all over the world who are tuned in. So as many of you know, HIV-related stigma, one of the biggest barriers to HIV prevention and treatment. So UNAIDS defines HIV-related stigma and discrimination as a process of devaluation of people either living with or associated with HIV and AIDS. Discrimination follows stigma and is the unfair and unjust treatment of an individual based on his or her real or perceived HIV status. I'd like to acknowledge here with us today Cesar Jordan, the Consul General of Peru. Very pleased to have you. Bienvenidos. As I mentioned, all across the world, people are tuned in via the live stream. Anyone can watch right now online with whocanyoutell.org. And I understand right now we've got some people who are tuned in from Peru, from Mexico, Puerto Rico, Uganda, South Africa, Jordan, and all across the United States as well. So well attended today. All right, fighting stigma requires extensive partnership with every segment of the community, and that's what has made this conference a success for 3 years now. To increase community involvement and awareness about HIV-related stigma, a call for posters and poems went out, and a special thank you to the Restart Educational Foundation, also the Washington Girls Middle School for their continued support of this activity, and many new entries this year from local and international students and AIDS organizations, and you can all take some time during the day and take a look at some of the posters and the poems which are available down in the lobby. Now, I'd like to welcome everyone to what's going to be a very action-packed day of learning, interacting, and building with dynamic speakers from all over the country and the globe. Now, biographies of all of the speakers and the agenda are available in the program book that you have, and also online at whocanyouTell.org. Again, I want to thank my alma mater, Howard University, for hosting this important topic in honor of World AIDS Day. And there is one small change to the agenda that everyone should note. Our original keynote speaker, Jeanne White Ginder, who's Ryan White's mother, had to be hospitalized, unfortunately. Yeah, and she's recovering right now from that surgery, so all of us certainly praying for her speedy recovery. But fortunately, we were able to find a fill-in today who I think you'll enjoy tremendously. All right, so to get us started this morning, please welcome Dr. Gregory Pappas. He's a Senior Deputy Director of the District of Columbia Department of Health. He leads HIV, AIDS, hepatitis, STD, and TB administration, also known as ASTA. He has over 25 years of experience in global health and worked in more than 30 countries and served as Senior Policy Advisor to former Surgeon General David Satcher. So let's put our hands together and welcome Dr. Pappas.
How cool to be on the stage with an Emmy Award winner. Isn't that wonderful? I'd like to start by congratulating Howard University on their third International Stigma campaign. It's been wonderful to watch this activity grow and be part of this. Yeah, there it is. I'm want to bring you welcome from Mayor Vincent Gray, the Mayor of the District of Columbia. He is an incredible boss. I can't think, as someone who fights leads the fight for against the AIDS epidemic in the District of Columbia, I can't think of a better boss. Mayor Gray is probably one of the best HIV mayors in the United States. The HIV has ascended to the One City plan. And I want to just reflect a little bit. I apparently have a little extra time, so I'm going to take a little extra time and share with you a few thoughts beyond my welcome. Rebecca gave me permission to do that. So it's important for me to recognize the incredible progressive legacy in the District of Columbia. And Howard, of course, is part of that. This is one of the most progressive cities in the United States. We don't always get that, that recognition. It's always, oh, what's wrong with D.C.? What's right about D.C. is that we have one of the most progressive HIV programs and policies in the United States. Just the headlines, the ones that bring a lot of interest. Treatment on demand. Everybody in the District of Columbia can get antiretroviral drugs to save their life and prevent the disease. We have medical marijuana. We have needle exchange, saving thousands of lives. We have a city that embraces gay marriage. There is an arc of leadership between the political establishment of D.C. that stretches back to Frederick Douglass, that represents freedom and justice in this country. And that political machine, that black political machine that is frequently beat up, gave this gay white man gay marriage. And I will forever be thankful for that. I want to put DC into context. This is a pretty knowledgeable group. You may have heard this before, but I think it's worth repeating on this day about stigma because I don't want to stigmatize DC. I want to put DC in the proper light. Half of people who are HIV positive in the United States live in 12 cities. DC is one of the 12. We're not the worst. We're not the best. We're one of 12 cities. When you look at DC as a metropolitan area. So DC, the District of Columbia, is our 64 square miles with about 600,000 people living in it that is part of a major metropolitan area. Metro DC, which is 5 million people. If you compare that 5 million people to other metropolitan areas, in other words, comparing apples to apples, compare it to metropolitan Baltimore, metropolitan New York, metropolitan Miami, and other metropolitan areas, you see that DC is, again, kind of in the middle. If you look at DC proper, just the center of the city, we find there are 14,000 people who are HIV positive. That's a lot. I mean, we have a serious epidemic. But that's, again, very similar to other center cities. If you look at Center City, Baltimore, Center City, New York, Center City, Houston, I think you get the point. I want to spend a little time with this group, because I see you as leaders, on what's called the continuum of care, or the care cascade. This is really driving the new effort in the fight against HIV. What we've been doing historically around education, around condoms, around testing, needs to continue. In fact, it needs to be ramped up. We need to do more of it. But this new part needs our attention and needs the understanding of leaders like yourself. And at every point in this continuum, at every point in this cascade, there are issues of stigma. So give me a minute, let me go through this with you. So the first bar here, first of all I want to say this is DC data, this is not national data, and DC's extraordinarily lucky to have this data. There are like 3 cities in all of North America that have this data at this point in time. We're way ahead of the curve. DC has one of the best data systems in the United States around HIV. The first bar here on the left is the number of people who know they're HIV positive. Oops. Over our best data, the cleanest data, this is for 5 years. So that gets you in the door for care. You got to know that you're HIV positive, right? You got to get a test and diagnosis. The next step is being connected to care. It's not good enough to just be out there and know you're positive. You got to see a doctor. You got to get into care. Some people need help. About 80% of people in DC who know they're positive are connected to care within 3 months. 90% a year. Actually, we're a national leader on that. We do extremely well on that linkage to care, getting people in the door of the doctor's office, getting them started towards getting their virus under control. Where we fall down, the big drop-off is here staying in care. Now, getting people in care, there's a stigma. First of all, getting people diagnosed, big stigma piece there. Big stigma piece here, getting people in care. But again, through the techniques we have, we work with people with stigma, we talk to them, we encourage them, we help them disclose their status to their family, because people don't want to go to the doctors because, oh, my family will find out, my friends will find out. So you got to work on that. The second part is this next part is keeping people in care, and it drops off. And this is a city where we have treatment on demand. 93% of adults in DC have health insurance. 96% of kids. We're the second highest in the nation after Massachusetts. We're a national leader in implementing health reform. Despite that very low barrier to care, we still have people who have difficulty staying in care. That's a big, big barrier. The next drop off here is ever achieving viral suppression. So the whole purpose of this exercise is to push the virus down, is to lock it in the cell, is to keep it under control. If it's under control, if it's locked in the cell, it doesn't float around your body, it doesn't destroy your immune system, and it doesn't spread to other people so well. You lock down the virus, you've heard this thing, oh, I'm at 0, I'm undetectable. Well, that means that there's not a lot of blood, there's not a lot of virus in their blood. They're less likely to spread the disease. But only about half of people who know they're HIV positive ever get to that state in one blood test. And then the very sad story here is that only a quarter of those who know they're HIV positive are continuously suppressed. This whole exercise that's costing us millions of dollars is to get the virus controlled and keep people suppressed over time. Now, with that said, we're about a tick ahead of the nation. We're not as good as where Dr. Colfax is from in San Francisco, where they do much better on this. We can be. And if we work together as a community, if we work on stigma to help people through all these steps, we can reach these goals. So with that, I'm going to, again, thank the organizers of the conference, thank our esteemed panel, and looking forward to working with you all this year as we look forward to a World AIDS Day 2013, where I'll have better numbers and more success stories. But thank you.